to assess global impairment of children in their relationships, school-related or work-related functioning, and self-fulfillment. Children of prescription opioid-abusing parents exhibited high BIS scores and therefore showed greater impairment, particularly if the parents attended any college, obtained prescription opiates through non-medical sources, administered drugs intravenously, were involved in court, or had at least one prior arrest. And what I would like to conclude is that families headed by drug-dependent parents are characterized by poor family management practices. They have high family conflict, low family cohesion, and high stress. Children in these families are subject to the consequences of their parents' difficulties, such as poverty, employment problems, poor living conditions, family violence, physical mental illness, trouble with the law, low educational attainment, and divorce. And so those who abuse prescription opioids place their children at an enhanced risk of global impairment, which may require services. And our objective is to break this intergenerational cycle of substance abuse and poor parenting. There's a recent study that showed that addiction in parents is associated with depression in adulthood in these children. And as I mentioned before, pregnant women might have substance abusing parents themselves, and there is an increased likelihood that their children will develop substance use disorder later in life. In these families, good role models for parenting are missing, and abuse and neglect is more likely to occur. Mothers who reported the perception of their own caregivers as uncaring were more likely to develop substance abuse later in life. So therefore, children of drug-dependent parents are at an elevated risk for drug abuse, delinquency, and the development of other behaviors, such as additional behavioral and emotional problems, less socially adaptive behavior,